If you are over 60 and wake up with a stiff neck, a sore shoulder, or a lower back that needs a few minutes before it will let you stand comfortably, pause before blaming your age or replacing your mattress. Your pain may be leaving a clue. Pain on one side of the neck can point to hours of rotation. A shoulder that hurts most when you first wake may have carried pressure through the night. And an ache that seems to travel from the hip into the lower back can appear when the upper leg quietly pulls the pelvis out of alignment. In this video, you will see 3 sleeping positions that can worsen existing pain. The safer alternatives you can try tonight, and a simple 3-pillow check that takes less than a minute. The final position is the most surprising because it is often recommended as the healthy choice. The problem is not the position itself. It is a hidden twist inside it that most people never notice. There is no single perfect position for every person. Arthritis, spinal stenosis, reflux, sleep apnea, old injuries, and past surgery can all change what feels safe. Never force a position that increases pain, numbness, dizziness, or breathing difficulty. Our goal is simply to reduce pressure, support sensitive joints, and help the body rest in a more neutral position. The first position to examine is stomach sleeping with your head turned to one side. Many lifelong stomach sleepers feel comfortable the moment they lie down. But comfort during the first minute does not always tell you what the neck and lower back will feel after several hours. To breathe while lying face down, you usually turn your head far to the right or left. Your chest and pelvis face the mattress while your neck remains rotated. If the head pillow is thick, the neck may also tilt backward. At the same time, the middle of the body can sink into the mattress and increase the arch in the lower back. The position does not suddenly become dangerous on your 60th birthday. The concern is that many adults over 60 are already living with arthritis, sensitive joints, old injuries, or changes in the spine. Holding an uncomfortable angle for a long time may make those existing problems more noticeable in the morning. Here is the clue. You wake with stiffness mainly on one side of the neck. Turning your head toward one shoulder feels harder than turning toward the other. You may also notice tension in the shoulder of the arm that spent the night tucked under the pillow, or an ache across the belt line. The first safer alternative is supported side sleeping. Roll onto your side and bend your knees slightly, not tightly against your chest. Place a pillow between your knees so the upper leg does not pull the pelvis forward. Your head pillow should fill the distance between your ear and the mattress. Your nose should point straight ahead, not down toward the bed and not up toward the ceiling. If side sleeping irritates a shoulder, do not give up. In a moment, I will show you how to support the painful arm so it is not left hanging across your body. Back sleeping is another option for some people. Place a pillow under your knees to reduce tension through the lower back, and use a head pillow that supports the neck without pushing the chin toward the chest. But there is an important exception. Obstructive sleep apnea is often worse when a person lies on the back. If you snore loudly, wake choking or gasping, or someone has noticed pauses in your breathing, do not rely on a position change alone. Continue any prescribed CPAP or other treatment and discuss the best sleep position with a healthcare professional. What if you have tried to stop sleeping on your stomach and simply cannot fall asleep? Do not spend the entire night fighting your body. Reduce the strain first. Try a very thin pillow under your head, or no head pillow if that is comfortable, and place a small, thin pillow under your hips and lower abdomen. That support may help reduce the arch in the lower back. You can also begin the night on your side for 10 minutes and allow the change to become familiar gradually. Now imagine someone like Margaret, a 68-year-old who still takes a morning walk but has started sitting on the edge of the bed because her neck feels locked when she wakes. By breakfast, the stiffness is much better. That timing does not prove that her sleep position caused the problem, but it gives her a reason to observe what happens at night. She discovers that she falls asleep on her side, then rolls partly onto her stomach with her head turned and one arm under the pillow. That one observation leads to the next position, because sometimes the arm and shoulder are the real problem. The second position is sleeping directly on a sore shoulder, or leaving the painful arm trapped overhead under the pillow or unsupported in front of the body. Shoulder pain at night can feel worse than it does during the day. While you are awake, the arm changes position constantly. During sleep, body weight may press on one sensitive area while the joint remains still for a long time. If you lie directly on the painful shoulder, the joint carries pressure from your upper body. If you roll onto the opposite side but allow the painful arm to fall across your chest, the weight of the arm can pull the upper shoulder forward. And if you place the arm above your head or under the pillow, you may keep the shoulder in an awkward position for hours. This is where many people make a reasonable but incomplete change. They say, "My right shoulder hurts, so I will sleep on my left." That removes direct body weight from the right shoulder, but the right arm is now on top. If it hangs forward without support, the shoulder may still remain tense. Here is the safer setup. Lie on the non-painful side. Use a head pillow that keeps your neck level. Then hug a second pillow with the painful arm. Let the pillow support the forearm and prevent the upper shoulder from collapsing toward the mattress. If you tend to roll backward or onto the painful side, place another pillow behind your trunk as a gentle barrier. You are not building a wall around yourself. You are simply giving the head, arm, and trunk somewhere to rest. If both shoulders hurt, try lying on your back if that position is appropriate for your breathing and medical needs. Place a thin pillow or folded blanket under the painful upper arm and elbow. The arm should feel supported near the level of the body. It should not hang backward toward the mattress, and the support should not be so high that your shoulder rises toward your ear. Now try the release test. Settle into the position and breathe out slowly. Allow the muscles around the painful shoulder to soften. If you still feel that you must actively hold the arm in place, adjust the pillow until the arm feels heavy and supported. The pillow does not need a medical label or a high price. The important question is whether it fills the gap under the arm without forcing the shoulder upward. If you recently had shoulder surgery, a fracture, or a joint replacement, follow the specific sleeping precautions provided by your surgical team. Those instructions take priority over general information. Before we reach the most overlooked position, tell me something simple in the comments. Which area usually wakes you first? Neck, shoulder, hip, or lower back? Just write the one area. Your answer may also help another viewer realize they are not the only one dealing with it. Now we come to the position that looks correct from across the room but can hide three separate problems. The third position is side sleeping with the body in a quiet twist. Side sleeping can be comfortable for the spine, and it may help some people who snore or have positional sleep apnea. But the instruction "sleep on your side" is incomplete. The details determine whether the neck, shoulders, pelvis, and legs are resting together or pulling in different directions. Picture what can happen after you become comfortable. Your lower shoulder stays on the mattress, but your upper shoulder falls forward. Your upper knee crosses the body and drops onto the bed. The pelvis rotates toward the mattress while the chest remains on its side. Then a pillow that is too flat allows your head to slope downward. You still appear to be sleeping on your side, but your neck, chest, pelvis, and legs are no longer facing the same general direction. For someone with hip pain, knee arthritis, lower back sensitivity, or morning neck stiffness, that position may be irritating. The unsupported upper leg can pull the pelvis forward, the knees can press against each other. A pillow that is too low or too high can hold the neck tilted, and the unsupported upper arm can pull the chest and shoulder forward. The clue is often a chain of discomfort rather than one painful point. You may wake with pressure on the inside of the knees, an ache on the outside of the hip, stiffness on one side of the lower back, and a neck that feels as if it spent the night on a slope. The safer alternative is a supported side position built around 3 gaps. The first gap is under your head. A side sleeper usually needs more pillow height than a back sleeper because the pillow must fill the distance created by the shoulder. But thicker is not automatically better. If the pillow pushes your head upward, it is too high. If your head falls toward the mattress, it is too low. Imagine a line running from the center of your forehead, through your nose toward the center of your chest. That line should feel straight. Your chin should not be forced toward your chest, and your face should not tilt toward the ceiling. The second gap is between the legs. Bend your knees slightly and place a pillow between them. If it feels comfortable, use a pillow long enough to support part of the lower legs as well. This helps prevent the top leg from dropping forward and pulling the pelvis into rotation. Do not pull the knees tightly toward the chest unless that position has been recommended for a specific condition and feels comfortable for you. The third gap is under the upper. Hug a pillow or rest the upper forearm on one. This keeps the upper shoulder and chest from collapsing forward. Think of your shoulders as one stacked pair and your hips as another. They do not have to be perfectly vertical, but they should not feel as if they are opening in opposite directions. Now try the 3-pillow check. It takes less than a minute. Settle into your usual side position. Remove the pillow between your knees for a moment. Notice whether the upper hip rolls forward or tension appears in the lower back. Put the pillow back. If the pelvis feels calmer, keep that support. Next, release the pillow you are hugging. Notice whether the upper shoulder falls forward. Hug it again. If the shoulder and chest relax, that second support is doing useful work. Finally, notice the head pillow. Does one side of your neck feel compressed while the other feels stretched? Adjust the height until the neck feels quiet and your face points straight ahead. This is a comfort and alignment check, not a diagnostic test. Stop if any change increases pain, numbness, dizziness, or breathing difficulty. You may now be thinking, this sounds useful when I first lie down, but I move during the night. How can I control what happens after I fall asleep? You do not need to control every movement. People normally change position during sleep. The aim is not to remain perfectly still. The aim is to begin in a supported position and make the most irritating position a little less easy to settle into. A pillow behind the back can reduce rolling onto a painful shoulder. A body pillow can support both the upper arm and the upper leg. If stomach sleeping irritates your neck, beginning on your side may give you at least part of the night with less rotation. These are gentle boundaries, not restraints. Return for a moment to Margaret, the woman in our example. She does not replace her entire bed or force herself into a perfect pose. She changes one thing at a time. First, she moves her arm out from under her head. Then she uses a thinner head pillow and places support between her knees. Over several mornings, she compares how her neck feels before she stands. If she notices improvement, that pattern suggests the setup may be helping. If nothing changes or the pain becomes worse, she has useful information to take to a healthcare professional. The goal is not to promise that a pillow will cure her. It is to stop guessing. You can use the same approach tonight. Before bed, notice how your neck, shoulders, hips, and lower back feel. Change only one part of your setup. In the morning, pause before standing and notice the same areas again. Repeat the setup for a few nights before drawing a conclusion unless it clearly increases your symptoms. There is also a difference between pain that exists all day and pain that appears mainly after sleep. If your shoulder hurts throughout the day, your sleep position may be aggravating an existing condition rather than causing it. If the discomfort is strongest on waking and settles after gentle movement, the night setup may be contributing. Neither pattern should be used to diagnose yourself. Please do not blame persistent or severe symptoms only on your bed. New or increasing weakness, numbness that does not quickly resolve after changing position, severe pain after a fall, loss of bladder or bowel control, or numbness around the inner thighs, requires prompt medical attention. Pain that repeatedly wakes you, continues to worsen, or limits your daily activities should be discussed with a qualified healthcare professional. If you snore loudly, wake choking or gasping, experience witnessed pauses in breathing, or remain unusually sleepy during the day, ask about possible sleep apnea. Side sleeping may help some people, but it is not a substitute for diagnosis or prescribed treatment. So remember the 3 positions and the safer changes. Stomach sleeping may keep the neck turned and the lower back arched. Try supported side sleeping, or back sleeping with support under the knees when appropriate. If you cannot leave your stomach, reduce the strain with a thinner head pillow and support under the hips and lower abdomen. Sleeping on a painful shoulder or allowing the painful upper arm to hang without support can keep the joint irritated. Move to the non-painful side and hug a pillow or lie on your back with the arm supported when that position is suitable for you. And side sleeping can still become a twisted position when the head drops, the upper knee falls forward, and the chest collapses. Fill the gaps under the head, between the knees, and under the upper arm. Your body does not need one perfect sleeping position. It needs less pressure, enough support, and permission to change positions when something feels wrong. Tomorrow morning, before you blame your age, pause for 10 seconds and notice where the discomfort begins. Your body may be showing you the exact gap that needs support, but even a well-supported night can be undone in the first few seconds after you wake. Many people twist the spine, throw both legs off the bed, and pull themselves upright in one fast motion. In the next video, we will look at a safer way to get out of bed after 60, especially when the back, hips, or knees feel stiff. Because sometimes the position that hurts you most is not the one you sleep in. It is the one you use to leave the bed.